Hi guys, in this video we will talk about working with medical students. At some point in our life we all have been medical student, and we know that at times it can be really challenging. We have a busy day with us and we may lack the foundational medical knowledge, and when you go home we may have to work on research, residency application, or just study for ourselves. So in this video I want to share some tips and techniques on how to interact with medical students. Number one point, always be thankful to a medical student whenever they are in your team. If it's a third-year medical student, they take over some of your patient, look their vitals, labs, and there's some responsibilities that you can always delegate to them, so they're helping you out. If it's a fourth-year medical student, they completely carry a patient by themselves, so that you have one or fewer patients in your panel. On top of that, a portion of your salary comes from the tuition that a medical student is paying, so always be thankful to them. Number two, when a medical student is asking us question, and if we repeatedly tell them to go look things up, it only discourages them from asking question. As a medical student, sometimes the foundational medical knowledge is lacking and they're only trying to learn, and sometimes we tell them to go look things up just to save our face because we may not know the answer. At those times it's much more better just to be honest and just admit that we don't know, and even better if we tell them that, hey, let's find some time this afternoon to look things up together, or tell them that I don't know the answer, but if I find it out I will get back to you. That builds up professional trust, and it encourages them to have a curious mindset and encourages them to ask more questions in future. Number three, when it comes to medical student teaching, I have noticed that sometimes residents predominantly focus on note writing. I want to remind ourselves that we have learned a lot of information as an intern, and these things can be much more helpful to a medical student than on learning on how to write notes. For example, you have learned how to manage patient with diabetes while inpatient. You have learned how to choose the right antibiotic whenever a patient presents with some infection. You know how to treat someone with diabetes ketoacidosis. You learn how to treat someone with arrhythmia. Teaching a medical student on this medical topic is much more better for you and for them, instead of predominantly focusing on writing note. Because when someone has a strong foundational medical knowledge, note writing becomes easy. So I want you guys to focus most of your teaching on practical aspect of patient management and medical knowledge as opposed to note writing. So in summary, these are my tips. Number one, be thankful whenever a medical student is present in your team. Number two, encourage medical students to ask more questions. And when we don't know the answer, it's much more honest and professional to admit that we don't know the answer. Number three, when you try to teach medical student, try to focus the teaching on medical knowledge more so than on note writing. Thank you for watching my videos. If you guys have any other tips and tricks you want to share on how we can make medical students experience better on the ward, be sure to write it down in the comment. Thank you for watching my video.